Well, sorry about that, guys. Baxter, well done for sorting that out. And it's a good example for all of us. Whichever profession you enter, especially the profession of being a healthcare worker, you will often face problems which are out of your control. And the key there is to stay calm and try to fix the problem without trying to lose control. And Baxter, you've certainly shown that today to all of us. So well done on sorting that. So let's continue with the presentation. So hi everyone, great pleasure to see or to speak to so many people interested in a healthcare profession. My name is Bilal, and before I start, I'll quickly tell you a little bit about myself. So I'm currently working in a very busy trauma unit, and I'm halfway through my emergency medicine training program. So I've got 3 years left before I become a consultant in the emergency medicine. And what I will be talking to you today is life post medical school, because I know you're right at the start and thinking of applying for medicine, but it's important to know what life is after medical school, your options, and certainly get an idea of what this career actually involves and what kind of career progression options you have. Okay, so what I want you to do is try to imagine that you have just finished medical school and you are getting ready to live that medic life. So you're expecting to do things such as this, playing golf in your free time, but in reality, what you will find is you will be bombarded with tasks at work and using your brain to the absolute limit when you are working in a hospital or a healthcare uh, providing facility. Okay, but there is light at the end of the tunnel, and as you move up your ranks through junior doctor to senior house officer and a registrar to the consultant level, you will have a bit more flexibility with your time. So it's important to know that there is light at the end of the tunnel, and certainly when you become a consultant, you have a bit more control over your working pattern, which will allow you to pursue any of the things you want to do in your life. So certainly, let's start with looking at the training program post medical school, because this is something which is very important to understand, and you could get asked about it in your interviews. So depending on your entry point into medical school, you will be looking at studying for 4 to 6 years, and when you come out with your degree, you will head into a foundation year one, where you will have between 4 and 6 monthly rotations. And at the end of the year, you will be fully registered with the GMC. Then heading into a foundation year two, again having 4 to 6 monthly rotations. This is that point where you start thinking about what specialty programs you want to apply for. And roughly there are 3 pathways, as you can see in this center area here. So let's start with core training. So whether you want to do medicine or surgery, this is the way into that field. That is through core training, which is usually 2 to 3 years. And once you come out of that core training, you can then decide on your subspecialty. For example, if you want to do medicine, you then decide whether you want to do cardiology, respiratory, whatever. And same with surgery, orthopedics, vascular, whatever you want. So then you look to spend another 4 to 6 years specializing in that specific specialty before completing your training as a junior doctor and becoming a consultant. Again, if you want to do GP, the training is slightly shorter, so you're looking at between 3 and 4 years after FY2 before you get your GP, before you get your GP consultancy. Okay, and then lastly, right at the bottom, again, don't worry too much about run-through training, but some training programs offer you run-through program, which means once you've sat your interviews after FY2, you don't really have to sit any more interviews. You enter the program and you come out the other end as a consultant, which is currently what I have with my emergency medicine program. So as you can see, this is quite a big commitment as you head into medical school and following that before you get to that consultancy level. But obviously, there are a lot of perks involved in a career in medicine, which I'm sure you're aware, and we can touch on some of them shortly. Let's quickly talk about the specialties and subspecialties available in this career. And if I had one slide which I could use to sell the career of medicine to you, it will be this slide right here. Okay, this is an extremely busy slide, and it is busy on purpose because it shows the number of options you have at your disposal when you decide to enter for a career in the medical field. Okay, and no matter what kind of personality you have, we are all unique in our own ways. You can just be yourself. Okay, you don't need to be someone else. You can be yourself and rest assured that once you come out of the medical school and heading into specialty training, you will find a specialty which will suit your personality. Okay, obviously there's a core set of skills such as communication skills, teamwork, all of that you know about, which is required from every potential medical student and every junior doctor, and that is something you will work on. But what I'm trying to say with this particular slide is no matter what your personality type is, you do not need to compare yourself to other medical students, other students that are applying for medicine, or even other doctors. Okay, just be yourself and portray that in your interview, because at the end of the day, whoever is interviewing you understands that with the broad range of options available to you, whatever your personality type, there will be a job for you. Okay, so bear that in mind, and this is quite possibly one of the biggest positives you can have when entering any career, is the options of flexibility and option to decide what you want. Okay, right, moving on. What I will now talk about is a day, a usual day for me. Okay, I know because of COVID-19, a lot of you have not been able to get hands-on shop floor experience or hospital GP experience. So what I will do is run through a couple of cases which I would see on my normal day, which what you would have observed if you were shadowing me, and hopefully give you a quick flavor of my life as an emergency doctor working in a busy trauma unit. Now, the field of emergency medicine is not the most popular field, and that is mainly because people think that it is like signing your life away to the devil, and that is mainly for long working hours, night shifts, weekends. But there are a lot of positives to this field, and let's see if I can pique your interest in them. So let's start off. So first of all, because of confidentiality reasons, none of these cases are my actual patients. These pictures I have used from medical textbooks and a medical website, but just to give you a flavor of what I would normally see. So on a normal day, I might get a patient who comes in with a shoulder dislocation, and having an individual such as this patient right here, who would be in extreme pain, and you would be their first port of contact. And as a doctor, your responsibility is to treat the cause, which in this case is shoulder dislocation. Now, the beauty of emergency medicine is you've got a problem in front of you, and you will have the required skills to treat it and fix it. So just using your bare hands, nothing fancy, no fancy equipment, you will be able to put this shoulder back in and treat this problem there and then, and see the results of your action in real time. Okay, there's no waiting around for weeks and weeks to see results. Whatever you do, because the problem is sudden and acute, your actions, the results of which are going to be there and then. Okay, which is incredibly gratifying when you're working as a doctor. And at the end of the day, if you are choosing a career in the field of medicine, that is ultimately what we are here to do, is to make a positive difference to patients. So very commonly we see shoulder dislocations, and it's quite simple. We put them back in, and straight away the patient is satisfied with the outcome. Similarly, again, on my normal day, I might see someone who's dislocated their elbow for a wide number of reasons, and again, using nothing fancy, our bare hand, we are able to pop that in and make a very positive difference to patient. Moving on, you might have someone who comes in with a fractured or a dislocated ankle. Now, this is incredibly painful, and the patient will be extremely distressed. But working as a doctor, certainly working as an emergency doctor, you will be using quite strong specialized medication to get this patient sleepy enough just to put that ankle back into a good enough position. And if you get all that right, the patient will be sleepy enough just for a minute or two to allow you to put that in, and then they will wake up. Okay, so that is again is very gratifying to see in real time. Or I might get a patient with a simple bruise who just needs a reassurance, and I have to do that a lot in my normal job. Moving on, the other spectrum, you might see someone come in with a complete flatline. So this patient is dead. Okay, in an emergency department, this is a common presentation, and you will see a few cases every day or so, and you with your team have the ability to turn this flat line into a heart rhythm that is compatible with life. And doing these cases, seeing these cases day in, day out, it makes the job worthwhile, okay? It makes those long nights, long weekends. Having the ability to manage patients in this way certainly is hugely gratifying, especially when you're able to see the results there and then. Very quickly, we talk about a few more cases. Here, the lung, where the arrow is completely collapsed. And as an emergency doctor, what you will here be doing is putting a plastic tube into the lung, into the chest, to try to expand that lung. There it is. That's the plastic tube. Again, in emergency medicine, you'll be going through a lot of procedures, a lot of different procedures in your normal day, and every patient is going to be different. Every patient will require a different intervention, and seeing different patients with different interventions, it's never going to get boring for you. Okay. Again, this patient might come in and he's got a huge lot of blood in the chest for multiple reasons. He might be involved in a road accident. Again, you will be stabilizing these kind of patients, putting in tubes, plastic tubes, like a similar case, trying to drain that blood off, trying to stabilize them as much as you can. Okay, or you might get patients who've been attacked. This here is a knife in a patient's chest. It's not uncommon to see this in a trauma unit or a major trauma center. These patients coming in and requiring quite significant amount of specialty treatment from yourself as an emergency doctor and from the rest of your team. Okay. Or if you're interested in being a superhero, then this is the closest thing you can get to: wearing a jumpsuit, jumping into a helicopter, and flying out to see the sickest people in the country and providing them support pre-hospitally. So life is not going to be boring, and no matter what specialty you end up choosing, you will have a great time. And certainly, working as an emergency doctor, I get to see these patients and get feedback from my interventions in real time, which is hugely gratifying. Okay. So I think we're running out of time, so I'll quickly talk a little bit about my reasons of why I wanted to do medicine. Going back to that slide initially with loads of opportunities, that was one of my biggest pulls towards medicine, is that I knew once I finished medical school, I will find something which will fit my specific personality and I will enjoy it, okay? It's an incredibly rewarding job. Another big factor is your work family. You will recognize when you work as a doctor, you spend more time in the hospital than you do out of hospital. And the people you work with become some of your closest friends and as close as family. So waking up every morning, knowing that I'm going to go into work and see my best friends and work with them, it makes work don't feel like work, okay? And I'm just going to take this opportunity to say that when you embark on a career in medicine, this is not a job. This is certainly a lifestyle and requires a lot of sacrifices to be made. And essential role in society, we can appreciate that now more than ever, that there will always be a need for healthcare professionals. Okay. For cons, high stress situations, again, these are personal for me. The high stress situation is a con and a pro for me, because I personally find with my personality, I work best under pressure, but working at that intensity day in, day out takes a big toll on the body, which could be a con. Extremely busy work schedule. If I post a screenshot, this is my rota for this week. I've been finishing at 2 a.m., which is my normal shift for Monday, Tuesday, Wednesday. And looking at my rota, I've got nights, Friday, Saturday, Sunday, 6 days a week. It is busy. I work in 1 and 2 weekends. But like I said, there is light at the end of the tunnel. And the higher up you move, your rota, your work pattern gets better. And certainly when you become a consultant, your working time and you have much more control over that. Okay. And lastly, I'm going to talk about sacrifices. We all know the sacrifices we have to make, but I would like to take this opportunity to tell you, always appreciate the sacrifices that your friends and family will have to make once you embark on a career in medicine, okay? Since becoming a doctor back in 2014, I have missed more weddings, more family events, more birthdays than I have attended. And that is mainly because of my working pattern and my rota type. And that will be the case when you start a career in medicine. So your friends and family will be making incredible sacrifices where they're missing your presence. I've let my friends down on multiple occasions because of my job, and they have to put up with me. So always appreciate that it's not just you who's making these sacrifices, it is your loved ones. So I think that's all I have time for today. Thank you very much for listening. Apologies for the initial glitch, and best of luck for your future careers, no matter what field of healthcare you choose. Take care.
Right, thank you very much, Bilal. That was very insightful, and like we say, guys, it's hard for Bilal as well to recover from those glitches. It wasn't just me that did well, or I tried to do well as much as I could to bring everything back to life. And I'm happy to say most of you guys that initially were there, 500 of you, have now joined again. So I'm really happy. So thank you very much for having the faith in us. But yeah, and very sorry about the few glitches. And Bilal's done an amazing job to keep us cool. That is the definition of an emergency doctor right there in front of you guys. When everything's just falling down, everything's hitting the fan. As a doctor, you just have to keep your calm, know what you got to do, fix it, and that's exactly what Bilal's done.
All credit to you here, I'm not
all right, we're just trying to hype each other up. But yeah, guys, thank you very much. So that's Bilal's talk done. What we're going to do now is next up, I'm going to get Neely to share her screen. So Bilal, you can share away. Thank you very much. And then Neely, if you don't mind coming along and just share your screen, and then I can put that up. So perfect. So just bear with me for a second. I'm just going to change a few settings. Hopefully this time not take the audio off. So let's see if we've got Neely's screen up. Perfect. We've got Neely's screen up. What we're going to do next is bring Neely's face as well, just so there's a face along with what you guys have. So Neely, if you want to turn your camera as well, if you don't mind. You have. Perfect. Just bear with me. Right. There we go, guys. So what we'll do is get Neely started. Right, Neely, go for it. And whenever you're ready, just take us away.
Hi everyone, so my name is Neely and I'm a physician associate, so I'm not a doctor, but I do work within the medical team. So as you all know, it's not just doctors, there are loads of different staff members who work in healthcare, such as nurses, healthcare assistants, and a new role, physician associate, which in America is called a physician assistant, has been shipped over to the UK just over 10 years ago. And so if you haven't heard about it before, that's absolutely fine. I only really understood what it was when I started the program myself. I graduated last year from the program. I studied in St. George's, University of London. And so I'm just going to tell you a little bit about what PA is and what it entails. So essentially, a physician associate is a generalist clinician, which means that we are patient facing and we are trained to the medical model, unlike other healthcare professionals such as nurses, healthcare assistants, radiographers. There are so many different people in the team. But PAs, we are trained to the medical model. So what does that mean? That means that we learn about the pharmacology, the pathology, the signs and symptoms. Essentially, we're trained in order to be able to treat, manage, and diagnose patients, just like doctors. However, we do have limitations in what we can do. And currently, some of those limitations are that we are not regulated. So that means at the moment, we can't prescribe or order ionizing radiation such as X-rays and CT scans, PET scans, things like that. However, there are pros of being a PA. So first and foremost, the best pro there is that physician associates can work in all different aspects of medicine, all different fields and specialities, and we don't need to do any further training. So what does that mean? It means that when we graduate with our either a postgrad or an undergrad, what will happen is you can choose any field of medicine you want to work in, and throughout your career you can chop and change as much as you want, as often as you want, or like myself, you can choose to settle down within a general practice and just carry on extending your career path that way. So that's one of the biggest differences and benefits of being a PA. So in terms of career progression, again, one of the negatives we can talk about a physician associate is that unfortunately, unlike doctors who progress up until they reach consultancy level, we do not. However, what we can do is once you are working in a medical field, speciality, so if you're working in gastroenterology, you can specialize in doing colonoscopies. So you can gain further skills wherever it is that you're working. Another benefit is that the starting salary of a PA within the UK is about £37,500 a year, unlike doctors who start off a little bit lower. However, of course, it's all in perspective, really, because as PAs, we don't necessarily increase our salary as often as medics do. So, entry requirements and how to get in. Essentially, you can either do an undergraduate entry to become a PA or a postgraduate entry. Most universities have the postgraduate entry, whereby you'll need to have at least a 2-1 in your undergraduate degree related to healthcare science. There are some universities who do accept non-healthcare related undergraduate degrees. However, they will require you to do a top-up foundation. It's sort of like something between an A-level and a degree. I think it only takes a few weeks to do it. So if that's something you're interested in. And the undergraduate degree is a 4-year program compared to the postgrad, which is a 2-year. And it's either a master's or a PG DIP. And the only difference between those two is that if you choose to do the master's program, you'll be expected to write a thesis project to gain the title. So just to tell you a little bit about what I do, so I work within primary care, which is general practice, and this is basically what my everyday looks like pretty much. So from 9 till 1 o'clock, up until recently, I've been locuming, so it means I've been contracting. However, as of Monday, I will be working permanently in one general practice. So this is most likely what my routine will look like. Appointment times, depending on how qualified you are, can range from 10 to 20, sometimes even 30 minutes. And at the moment, because of COVID, you can either have a telephone consultation, a video consultation, or you can invite patients in for a face-to-face appointment as well. And so from 9 till about lunchtime is what I would usually do. And those appointments usually consist of either same-day emergency appointments, or if I've spoken to someone and I want to see how they're getting along, they're pre-booked appointments for me to follow them up, or any pre-booked appointments that patients do have. And then from about 1 to 2, it's lunch, but we do quote-unquote lunch. Some places you're worked to the bone and you don't always have, a nice hour lunch. Most 99% of the time you will be doing your admin, so spending time sending off any referrals for your patients, requesting any x-rays, as a PA, because we can't prescribe and order ionizing radiation, sometimes more often than not, I will go into my lunchtime with lots of questions I have for my supervisor. And so if there's anything I'm struggling with during my morning appointment, I'll also use maybe half an hour of my lunchtime to knock on my supervisor's door, talk to them, run anything by them that I'm not 100% confident on. And then again, I also spend the rest of the time sorting out letters that come into the GP from hospitals, from consultants who are taking care of my patients. And then afternoon clinic usually resumes from 2 till about 4:45 is my last appointment. And again, it's sort of similar to the morning clinic. And yeah, there will be different things in the day. So for example, some GPs are only open half a day on one day of the week. Some GPs have regular multidisciplinary team meetings on Wednesdays or whatever day of the week that they've chosen. And you may be asked to run audits to see how well the practice is doing, check if they're meeting their deadlines. So that's sort of the duties that you would be doing and being involved with as a PA working in GP. So just a brief GP versus PA. There's loads of there's loads of similarities and differences. And so the main ones are that PAs can't prescribe or order ionizing radiation. Now, how do I combat that? Thankfully, at the moment, all the general practices I've worked in, we do electronic prescribing, which means that I will type up the prescription I want, to give to the patient, it will electronically send to any clinician who's qualified enough to prescribe. So whether that's a prescribing pharmacist, whether that's a prescribing nurse or a doctor, they will then approve or decline my request of the medication. However, if you're prescribing something within your scope and within your understanding and your competency, usually no one will ask any questions or have any issues with that. So then what will happen is once it's improved, it will send straight to the pharmacy, ready for the patient to pick it up. And in terms of any ionizing radiation requests, I'll just write it down on a notepad and pen, or send my supervisor a little IM message on the system, and then they will organize it for the patient. Or you just print it off and get the doctor to sign it. It's super, super simple. So another benefit I want to say for a PA is that throughout our career, we always have the advantage of asking someone else for a second opinion. And of course, this isn't just for PAs. This is something that all healthcare professionals do. And that's why we have things such as multidisciplinary team meetings. As a PA, you probably get a lot more time and a lot more lenience on the door being constantly open for you to asking questions. And I think it's really good. It's really beneficial, especially once you're newly qualified and, you will have a lot of learning on the job to do. So it's really beneficial to be able to have a supervisor who will be happy to answer any questions and also take part in a lot of teaching for you as well. So in terms of both career progression for working within a general practice, depending on what you want to do and what your goals and ambitions are, is you can work your way up to become a practice partner. And so everyone can do that. A nurse can do that. Paramedics work in GPs as well. Pharmacists also work there. So each individual, if you've proven your loyalty and you're really motivated, after a few years, you might be invited back to join the team at a higher level. And you can also take part in gaining more skills. So things such as minor surgeries is a really common one within general practice. This can be things such as removing any skin tags, doing any skin biopsies and sending them off. You can do things such as steroid injections in the joints. So there's so many options available, so many things you can do to kind of increase your level of work, really, and your career. So personally, I think it's, obviously I'm biased because I am a PA, but I think it's great. I think it, as Bilal was saying earlier, as a medic, you are going to be sacrificing a lot of things in life. However, I think as a PA, there's a lot less to sacrifice. You have a much better work-life balance where you won't be doing night shifts if you don't want to. You won't necessarily be doing on calls. You can opt to have a 9 to 5 job, whether it's in primary care, GP, or secondary care, which is in hospital. In GP, you can do things such as locuming. You can work on the weekends from home if you want to. It's not expected of you. You can do after hours in the GP. So really, you can mold it to suit your lifestyle, and you can, obviously, the flexibility of working in different specialities is obviously a really big bonus as well, especially if you have more than one special interest in medicine. Okay. And that's it, really. I know mine was super short and sweet, but if you have any other questions that I'm unable to answer in this work experience session, you can find me on all of these platforms under those 2 handles. So thank you.
Right, thank you very much, Neely. So what I'm going to do is just move my screen slightly different somewhere else, just so you guys can see how to get through to Neely. So yeah, thank you very much. Amazing presentation again, another one. So main things, guys, to take away from that one is just to be aware of the other roles as well. And also physician associate programs, I'm sure Neely, you would agree as well, like you were saying, are so new to the UK. In America, they've been going on for so many years. I did my elective in America, and I really got to see what a difference they make. And in my hospital, we have physician associates as well, and it's just a growing career. And it's, for years and years, a lot of people have been thinking that it's either medicine or dentistry and that's it. And no, that's not the case. There's now other further careers that you guys can also go into. So something for you to consider. But also, if you are really dead on set on medicine, then what you need to learn from this is what other members of the multidisciplinary team are doing. So what physician associates are doing, other members, again, nurses, physiotherapists, social workers, everyone, because you may get asked about that during interview. You may also get asked, okay, why have you done medicine, and why are you applying for medicine? Why would you want to do physician associate program? So it's really important to have an understanding what the career is. I hope you guys are making some notes, because it is going to be super useful. I think, Neely, because of time, we're going to do the Q&A all at the end if you're happy with that. So guys, if you type in your questions on the poll I put up on my story, we're going to go through that at the end. I know we've been running a bit behind because of what happened with everything, but Neely, thank you so much again. You've been awesome. If you just turn off your video and microphone, and then what we'll do next, guys, is we will get Sana Nav up next.